Every 37 seconds, somewhere on this planet, someone collapses from a stroke, and by the time you finish this sentence, another human brain has been permanently damaged, with nearly 6 million stroke deaths worldwide every year, making it the third leading cause of death, and the #1 reason adults lose their ability to walk, talk, or live independently. But here is what nobody tells you clearly enough. In a huge number of cases, your brain sends you very specific warnings hours or even days before the big stroke, and you just have to know what they look like. Stroke is not a random event where you were fine one moment and woke up in the hospital the next. In most cases, it is the predictable endpoint of blood vessels that have been quietly degrading for years, and if something is predictable, it is at least partly preventable, which is the entire point of this video. When doctors say stroke, they are actually talking about two very different events in the brain. One is a hemorrhagic stroke where a blood vessel bursts and blood pours into the brain, compressing tissue and killing many patients instantly. And the other is an ischemic stroke where a vessel gets blocked, blood flow stops, and brain cells in that zone start dying within 4 to 6 minutes, with ischemic strokes making up about 85% of all strokes. Your brain weighs roughly 3 pounds, just 2% of your body weight, yet it uses around 20% of all the oxygen you breathe and 25% of all the glucose in your blood, making it a control center that never turns off and needs a constant fuel line. Cut that fuel for even a few minutes, and cells start dying in ways you cannot reverse. Which is why doctors say stroke is literally a race against time to save brain tissue before it is gone forever. For a brain artery to suddenly block, the groundwork usually took years. The vessel walls got damaged, cholesterol and clots built up, and the opening got tighter and tighter. So this is not an explosion out of nowhere, but the last step of a long process. And along that road, your body usually sends out warning signals called a transient ischemic attack, or TIA for short, which means temporary. Picture your carotid artery, the main neck artery carrying blood from your heart to your brain. Over years, a fatty plaque forms on the inner wall, the opening slowly narrows, and then at some point, the already tight vessel goes into a brief spasm. Blood flow stops for a few seconds or minutes, and the brain area fed by that artery blacks out, so you see or feel a stroke symptom. Then the spasm relaxes, blood flow returns, the symptom fades, and you think you are fine again. Research shows that a TIA very often comes right before a major ischemic stroke, typically within the next 72 hours, and those 3 days are your window where the disaster can still be prevented. But most people do not use that window because the warning episode was short, strange, and then went away, lasting anywhere from 30 seconds to maybe 10 minutes, which is exactly why they slip through the cracks while you are in your kitchen, the shower, or getting out of a car. Here are the 5 big red flags you must know. The first warning sign is temporary blindness in one eye. You get up, walk toward the kitchen, and suddenly one eye goes dark or foggy like someone pulled down a black curtain or smeared the lens with gray mud. You blink a few times, and within seconds or a minute, your vision comes back. So you blame it on standing up too fast or too much screen time. But in reality, that curtain is almost always a tiny clot or a small fragment of plaque that broke off from your carotid artery wall, traveled up, and briefly plugged the artery that feeds your eye, which is a direct branch of the same artery that feeds your brain. And when that clot drifts away and blood flow restarts, you feel lucky, but that exact same clot could have gone 2 millimeters to the side into a brain artery, and instead of a 1-minute blackout in one eye, you would be looking at permanent loss of speech, paralysis of an arm and leg, or death. The second warning sign is sudden numbness or tingling on one side of your body. It can be your whole arm, just your hand, half your face, or one full side of your body, feeling like pins and needles, cotton or rubber, and it comes out of nowhere while you are just sitting, walking, or talking, lasts a few minutes, then goes away on its own. And unlike sleeping on your arm where nerve compression causes numbness that clears up when you move, With a TIA, the problem is not in your arm but in the brain area that maps sensation from that arm, and the episode has nothing to do with posture. The third warning sign is a sudden loss of coordination. What people describe as a drunk walk without any alcohol, where you are on a flat familiar surface and out of nowhere your foot lands in the wrong place. Your leg feels weak or rubbery, you stagger into the wall, or you get hit by a sudden strong spinning sensation that makes you grab a chair or door frame even though you were not spinning. You did not jerk your head, and you did not just stand up from bed, because the part of your brain that keeps you balanced and coordinates smooth movement is called the cerebellum, and when blood flow drops sharply even for a few seconds, the cerebellum essentially glitches. The fourth warning sign is in your speech. If you occasionally cannot remember your neighbor's name, or you temporarily forget the word for toothbrush, that is not a stroke sign but a normal tip-of-the-tongue moment. But what worries doctors is when your speech suddenly breaks down so badly that even you feel something is seriously wrong, like you understand everything people say, but you cannot get the words out because they come out slurred, chopped, or stuck, or you speak fluently but say complete nonsense like word salad and cannot understand simple phrases directed at you. The fifth warning sign is a combination of certain skin changes plus new unusually strong headaches. The skin condition is vitiligo, patches of pale or completely white skin where pigment-producing cells have stopped working, which is an autoimmune process where your immune system starts attacking your own pigment cells. And when your immune system goes off target like that, it often does not stop at one organ, but can quietly inflame the inner lining of your blood vessels called the endothelium, the microscopically thin non-stick coating inside every artery. And when that coating is damaged by inflammation, it becomes rough and scarred, making cholesterol, platelets, and inflammatory proteins cling and form plaques and clots over time. One of the biggest myths is that if your cholesterol is normal, you are safe from stroke. But stroke risk is not just about what is floating in your blood. It is about the condition of that endothelial lining, and the first major enemy of the endothelium is chronically high blood sugar. Because when your body does not make enough insulin or your cells become resistant to it, the vessel lining cells starve, get damaged, lose their shape, and leave behind rough scar-like patches that are perfect landing pads for bad cholesterol. The second big vascular enemy is smoking. Cigarette smoke contains thousands of chemicals that cause direct chemical damage and inflammation to the inner surface of your vessels, while nicotine and carbon monoxide make your blood thicker and stickier, increasing how easily platelets clump and clots form, which is why smokers have roughly 2 to 4 times the risk of an ischemic stroke compared to non-smokers with similar cholesterol and blood pressure numbers. Now, what do you do if you have already had even one of those 5 warning episodes, even if it felt small and vanished in under 10 minutes? You have roughly 72 hours where a lot can still be done to prevent a full-blown stroke. Do not drive yourself. Do not be alone. Tell someone what happened. Lie down flat with your legs slightly raised above chest level and your head neutral. Check your blood pressure, and if your top number is 180 or higher, or your bottom number is 110 or higher, call emergency services immediately and never start blood-thinning drugs like aspirin on your own. Because if your stroke is hemorrhagic, thinning your blood will make the bleeding faster and larger. There are 3 evaluations you should ask your doctor about if you have had any of these warning signs: a carotid duplex ultrasound to see blood flow in your neck arteries, an HbA1c blood test to measure your average blood sugar over the last 3 months and catch prediabetes, and a 24-hour Holter monitor to record your heart rhythm and catch hidden atrial fibrillation, which is a condition where clots form in your heart and travel to your brain, responsible for nearly 25% of all strokes in older adults. Stroke is not a lightning bolt from a clear sky. It is a predictable event that comes after years of silent vessel damage, and it often announces itself in advance through temporary blindness in one eye, sudden one-sided numbness, sudden loss of coordination, sudden speech breakdown, or vitiligo combined with new severe headaches, and any of these showing up for the first time, even if they vanish in a minute, is a reason to talk to a doctor urgently. If this made a complicated topic easier to follow, subscribe to Dr. Voren, hit the like button, and help this channel reach 100,000 subscribers because your second chance won't wait.